So this is really off-label. This is only FDA cleared for intraocular treatments of retinal detachments. And fortunately, as you probably know, it is legal to do this with a lot of consents. In the early 90s, it was illegal during the time that there was no FDA clearance whatsoever. The anesthesia that I use is, I really like to make the patient comfortable. What I use is Citness first as a pre-block into the dental mucosa, and the reason for that is that it just doesn't burn. It doesn't really create much of an anesthetic load in terms of benefit, so I reinforce that with plain carbocaine. I find that to be a very short-acting block. When I do silicone lip revisions, I'm winding up using a 4% Septocaine for two reasons. One, it gives me that 30-minute time to do the reduction. It also rides them through the next few hours so that they don't have the discomfort level in the first few hours. And I then add a 1% lidocaine with epi for hemostasis into the actual direct infiltration into the lip, obviously after I've already marked them out. So what are the advantages of silicone? I think part of the thing, there's a lot of injection burnout. When people come in for their lips and their Juvederm only lasts them 6 weeks to 2 months, they keep on coming in. They're not going to come in all the time. And they ride this roller coaster. Rob Glasgow mentioned this to me, the roller coaster where they go up, they look great, then they overinflate and they go down. Silicone just is that slow build where it's permanent, and it's incredibly soft. And I can challenge you and say that I can't find any other product out there that is natural as silicone in terms of you just can't tell it was done if it's done well. And I'll show you some of my lips in a moment. Very natural in appearance, and also even more important, or as important, that is it feels soft. Unless you're pushing it, I'm going to show you some of that, it feels very soft in lips. You can't even feel it. And the only thing you want to be careful is that lips do change with age, and lips do change with style and aesthetic. So you want to be more conservative, and you certainly want to avoid bad technique. So what are the strategies here? I really use silicone as my baseline work to get a patient looking great. And then I come back if there's, you know, I really want aggressive lips. Well, then that's when I start looking at, why don't we do a few months to years of Juvederm Restylane on top of the silicone, just to make sure you really want it that big, because it's hard for me to reverse it. Avoiding complications. I really don't use more than 0.4 cc. What is your load, Tom? How much do you put per lip?
Upper and lower, usually 0.7.
0.7 total?
Yeah.
Or 7.7?
No, 0.7.
Okay, so it's pretty similar to mine, because I do 3 and 4. So I've heard anything from 0.2 to 0.5. I find 0.4 to be a very safe amount, and 0.3 in a slightly smaller lip. And I'm only putting 1/100th of a cc per pass. My nurse Diane, who's very OCD, actually counted how many injections, like 75 passes for like 30-some per lip. And the key with this is you don't know really what plane. Everyone asks me what plane is it in. Well, it's sort of deep to the mucosa, but I don't know what plane I'm in. I just sort of go in there. The only caveat is you don't want to pass it past to the other side, to the back mucosa. And always, always, always wait a month. If you're putting a few droplets in, you need time for that micro droplet not to coalesce, but to really be walled off by collagen before you come back for your second round. So be very careful with that. Some of my results here. Usual average is about 2 to 3 treatments. And this is a 5 treatment result. Her lip is slightly firm, and I actually encourage her to stop. She wanted more, but if you see the real key of this, I didn't really go too much over the aesthetics. You want to design a lip that looks natural. There's a nice cleft in the center. There's a taper. The larger lip is in the bottom lip. The upper one is just modestly augmented. You want to be very careful in creating a nice lip. Another lip result for a younger lady in her mid-20s, and you can see it's a very natural lip. It's very hard to get this kind of result with Juvederm and Restylane, especially the way it feels. It's just totally soft and natural. And in terms of revision silicone lip results, how do you do it? Well, I actually cut the lip out. I think you got to do that. This is a lady from another country that had silicone lips. This is why you guys don't do it, because you see this and you go, God, I don't want to have that problem. Well, I really don't see that problem, and the experienced colleagues that are friends of mine really don't see those problems, because they really take care not to create this kind of travesty. So this is 2 lip reductions on the upper lip, taking both wet and dry mucosa down, and then going back and building the bottom lip over 3 sessions so that I can create parity. Remember, the lower lip must be larger. The number one thing when patients come in, they want their upper lip done, but always make sure you balance it with the bottom lip. Another lady here, and when I talked about nice shape, this is the antithesis. It's too much shape. There's too much cleft division on the bottom lip. The upper lip is too big, and then there's also too much of a show. So I softened the upper lip, I narrowed the break on the bottom lip, and then augmented the bottom lip with more silicone, to fix her silicone, to balance it. So this is actually not a reduction. This is adding more silicone to fix someone else's silicone. And this is some weird Gore-Tex that was actually removed, leaving scar into the white portion of the upper lip. It looks very unnatural. It looks like a duck lip shelf. And so what I did was I built the bottom lip with 2 sessions of 0.4 silicone. Then I just went in there and just touched a little bit to that shape. Again, this is an example of some lips you see they're just too big and flat. Some lips have too much shape. This is breaking the shape of the lip without actually going there and augmenting the upper lip, because you want to de-emphasize that white roll duck-looking lip. And that's something that's just very hard to take out. You just want to de-emphasize it by creating more of the bottom lip. This is actually just this weird silicone bulginess on the outer lips. I just curtailed just shaved off and cut out the outer portion of the lip, and then built her bottom lip with that heart-shaped lip with 2 rounds to get her more balanced. So managing complications, really it's almost impossible to extract. Don't try to go cut it out. What you got to do is just cut the lip down, and that's the best way to do this. And make sure that, remember, there's a balance between too much shape and too little shape. And always have an aesthetic eye. If you're doing this, don't just do lips and blow them up. Think about how the lips should look like so they look natural. I appreciate your time. This is my email if you want to ask me questions. Thank you very much.